Good evening and Assalamu alaikum. I am Taslim Shahriar, fifth year medical student from Khulna Medical College, and I am presenting on behalf of Dr. Ashiqur Rahman Ashiq because he is now in Canada for pursuing his MSc. And today I will present the study titled "A Fear of COVID-19, Depression, Anxiety and Stress Symptoms Among Bangladeshi Medical Students Amidst the Pandemic, Finding from a Mixed Method Study." And we already know that on March 11, 2020, the World Health Organization declared COVID-19 as a global pandemic, and till today, 273 million people have affected by COVID-19, and 5.3 million people already died. And in Bangladesh, 1.5 million people have already affected, and 28,048 people already died. And during this pandemic period, our doctors, frontline workers have done their good job, and because of this high pressure, doctors are suffering from high rates of anxiety and stress symptoms as well as the post-traumatic stress. And healthcare workers are fighting from the front line to save the lives of the people. And medical students who will be the future doctors, future frontline workers, are also being part of this anxiety. And around, I'll skip this slide. And 1/3 medical students worldwide have the anxiety and depression. And because of this pandemic, they are affected, their prevalence to fear of COVID-19. And combined effect of this stress of enormous academic pressure and fear of facing the COVID-19 pandemic disrupts their mindfulness and mental well-being. And our rational study of our study was that to ensure the psychological soundness of the future torchbearer of health discipline, their fear of COVID-19 and associated mental health problems should be assessed, and this will help to identify mitigate the fear factors and make a medical student and physician friendly environment. And our main objective of the study was to ensure the severity of fear of COVID-19 and associated depression, anxiety and stress among medical students from Bangladesh. And these are the specific objectives. I will only highlight the second point, to find out the associated factors for fear of COVID-19 among the medical students of Bangladesh. And these are the methodology of our study. This was a multidisciplinary methodology. It was both quantitative and qualitative. On the quantitative part, it was a cross-sectional study, and on the qualitative part, it was a manual thematic analysis. And the study was followed by Cherry's e-survey guidelines. And it was conducted on 53 both private and public medical colleges around the country, and from June 2022 September 2020, and first year to fifth year medical students were concluded in our study. And on the sample, 10 students were selected for the focus group study for the qualitative purpose, and our quantitative data was collected from 406 participants. First to fifth year medical students all over the Bangladesh and who had access to internet were concluded or included in our study, and who were previously diagnosed with other mental disease were excluded from our study. And data collection instrument was that where pre-tested and validated online questionnaire were used, which included socio-demographic characteristics, validated Bangla fear of COVID-19 scale, and validated Bangla DAS 21 scale was used. And on qualitative part, one focus group discussion including 10 participants was conducted over Zoom video call, and the whole session was recorded, transcribed and translated to further analyze the qualitative data. And these are the results from our study. Most of the participants were from 20 to 22 age group, and most of the participants were female, and most of the participants were from third year medical school and from middle income family. And these are the COVID-19 information. 6% of the participants were tested positive, and 17.2% participants said that their family member were tested COVID-19 positive, and 65.5% participants said that their neighborhood were tested COVID-19 positive. And these are the statistically significant results from our study. It showed that female medical students had 1.6 times the fear of COVID-19 than their male counterpart, and those who had children in their families had 1.6 times the fear of COVID-19 than those who did not have, and those who were experiencing reduced sleep had 3.6 times the fear of COVID-19 than those who did not experience alteration of sleep. And these are the prevalence of the anxiety, stress, and depression among Bangladeshi medical students. It showed that our study showed that 64% of our participants had depression, 59.4% of our participants had anxiety, and 51.2% participants had stress. I will only focus on the important parts. And the alteration of the sleep pattern and whose family member were affected in COVID-19 were mostly prevalence to the anxiety, stress, and depression. And on our qualitative part, we described in 4 sections, and it was the perception of fear of COVID-19 and perception on mental health impacts during COVID-19 and change in medical curriculum and recommendation. And I will quote two of our participants. One said in the perception of mental health impacts during COVID-19 that right now I do not feel good in my home, neither I am enjoying a long sleep nor Facebook. I am not enjoying anything now. And another of our participants said in the change in medical curriculum section that medical students from 3rd year onwards can be trained for this kind of situation, so that when there is a shortage of doctors or to help them during their roster duties, students can come forward. And here's the discussion from our study. In our study, we found that students of medical sciences, particularly females, experience more fear of COVID-19 and reduced sleep pattern of the participant and had increased the fear of COVID-19. We had also few limitations in our study, and it was an online study, so we couldn't diagnose depression, anxiety clinically, and more focus group discussion and in-depth interview would suffice the qualitative findings. And the study offers the key information and baseline data on medical students' fear for COVID-19 and associated prevalence on depression, anxiety, and stress. And the findings of the study should be taken into consideration, and appropriate, adequate interventions should be designed and implemented by the authority. And there are some recommendations from our study, and these are the designing and implementation a mental health support system dedicated to the medical students with special attention to female students. Students should have easy and safe, confidential access to seek psychological support from the experts of the respective medical colleges, and amendment of the medical curriculum, adapting or development in online class system, empathetic and students-oriented teaching staff can bring some positive changes to reduce the mental health burdens of the medical students. And thank you, everyone.